Hi, today we will talk about clinical anatomy. Clinical anatomy, applied anatomy, emphasizes aspects of bodily structure and function important in the practice of medicine, dentistry, and the allied health sciences. It incorporates the regional and systemic approaches to studying anatomy and stresses clinical application. Clinical anatomy often involves inverting or reversing the through process typically followed when studying regional or systemic anatomy. For example, instead of thinking the action of this muscle is due, clinical anatomy asks how would the absence of this muscle activity be manifest. Instead of not noting the nerve provides innervation to this area of skin, clinical anatomy asks numbness in this area indicates a lesion of which nerve. Anatomico-medical terminology. Anatomical terminology introduces and makes up a large part of medical terminology. To be understood, you must express yourself clearly, using the proper terms in the correct way. Although you are familiar with common colloquial terms for parts and regions of the body, you must learn the international anatomical terminology. Axillary fossa instead of armpit and clavicle instead of collarbone. That enables precise communication among healthcare professionals and scientists worldwide. Health professionals must also know the common and colloquial terms people are likely to use when they describe their complaints. Furthermore, you must be able to use terms people will understand when explaining their medical problems to them. Terminologia anatomica and terminologia embryologica list terms both in Latin and as English equivalents. The common shoulder muscle is musculus deltoideus in Latin and deltoid in English. Unfortunately, the terminology commonly used in the clinical arena may differ from the official terminology. Because this discrepancy might be a source of confusion, this text clarifies commonly confused terms by placing the unofficial designation in parentheses when the terms are first used. For example, pharyngotympanic tube, auditory tube, eustachian tube, and internal thoracic artery, internal mammary artery. Eponyms, terms incorporating the names of people, are not used in the new terminology because they give no clue about the tube or location of the structures involved. Further, many eponyms are historically inaccurate in terms or identifying the original person to describe a structure of a sign, its function, and do not conform to an international standard. Structure of terms. Anatomy is a descriptive science and requires names for the many structures and processes of the body. Because the most terms are derived from Latin and Greek, medical language may seem difficult at first. However, as you learn the origin of terms, the words make sense. For example, the term gaster is Latin for stomach or belly. Consequently, the esophagogastric junction is the site where the esophagus connects with the stomach. Gastric acid is the digestive juice secreted by the stomach, and a digestive muscle is a muscle divided into two bellies. Many terms provide information about the structures, shape, size, location of function, or about the resemblance of one structure to another. For example, some muscles have descriptive names to indicate their main characteristics. The deltoid muscles, which cover the point of the shoulder, is triangular, like the symbol for delta. The fourth letter of the Greek alphabet, the suffix "oid", means like terebor. Deltoid means like delta. Biceps means two-headed and triceps means three-headed. Some muscles are named according to their shape. The piriformis muscle, for example, is pear-shaped. Pirium, pear, Latin forma, shape or form. Outer muscles are named according to their location. The temporal muscle is in the temporal region, temple, of the cranium, skull. In some cases, actions are used to describe muscles. For example, the levator scapula elevates the scapula. Latin shoulder blade. Anatomical terminology applies logical reasons for the names of muscles and other parts of the body. And if you learn their meanings and think about them as you read and dissect, it will be easier to remember their names. Abbreviations. Abbreviation of terms are used for brevity in medical histories and in this and other books, such as in tables of muscles, arteries, and nerves. Clinical abbreviations are used in discussions and descriptions of signs and symptoms. Learning to use these abbreviations also speeds note-taking. Thanks for watching today. Subscribe, share, like.